Your physician has recommended that you undergo a regular treadmill test at the Oregon Heart and Vascular Institute at Sacred Heart Medical Center. The purpose of this test is to see if your heart gets enough blood while you are exercising. Before having this test, you will change into a patient gown. Sticky patches are placed across your chest that transmit the heart rate and rhythm. During a regular treadmill test, you will walk for as long as you can, up to approximately 10 minutes on the treadmill, while our trained technicians and nurses stand next to you and monitor your EKG, blood pressure, and symptoms. If you are having a metabolic stress test, you will have a mouthpiece to collect the air you breathe in and out. A machine will analyze your breathing and provide important information for your doctor about how your heart, lungs, and muscles respond to exercise. This test may also be called an oxygen uptake consumption test. For either test, we will gradually increase the intensity of your session, starting at a lower level and advancing to a higher level appropriate for your fitness level and condition.
How hard are you working right now?
The goal is to attain a maximum heart rate and peak effort appropriate for your age, achieving an exertion level of 8. You will be working hard but still be able to talk to us. This will give us the best information for this test. Afterwards, a cardiologist will compare the resting and exercise electrical activity of your heart. The regular treadmill test is one of the shortest and simplest forms of stress testing. The results we get from this test may assist in diagnosing your symptoms and in evaluating other treatment options for your continued care. Your test results should arrive at your physician's office within 5 working days. If your physician has not notified you after this period of time, please call his or her office. Your participation in this exercise test is voluntary. You are free to stop the test at any point if you so desire. We want to make your testing session as safe and as accurate as possible. You can help us by providing any information you have about your health status or telling us about any unusual feelings you've had from physical exertion in the past. Let us know immediately if you have any of these feelings during the stress testing. Symptoms such as chest pain, tightness or pressure, shortness of breath, arm, back, jaw, throat, or ear pain could change the way we proceed with the test, so please report this information to us immediately. We must make you aware that in very rare circumstances you may be at risk for heart attack, stroke, or death. Keeping your test as safe as possible is first and foremost in our minds. Because this test stresses your heart, every effort is made to minimize risks. We evaluate the preliminary information gathered about your health and fitness, and you are closely monitored during and after testing. Emergency equipment and trained personnel are available for any situations that may arise. At the Oregon Heart and Vascular Institute at Sacred Heart Medical Center, we perform hundreds of these tests each year. Our highly trained staff is here to provide quality care while you're having this test. Again, please let us know if you have any questions or concerns.